Welcome back to planore. This is the part 2 of the introductory video on OSCE. OSCE is one of the components of the ORE Part 2 examination. In this video, we would be learning some features about the actor OSCE. Please have a look at Part 1 video where we have discussed the general features of an OSCE, how the exam is conducted, and a few things about the written OSCE. So stay tuned for Part 2. If you like us, come join us at planore or contact us through any of the following. So the factors you need to consider for the actor OSCE are very much similar to that of a written OSCE in basis of time. It is the same 6 minutes OSCE where you are told a question in the 1 minute outside and you need to perform the OSCE in 5 minutes inside the room, making a total of 6 minutes. More details about the time of OSCE is given in Part 1. Other than that, you need to be very thorough with the clinical aspects of dentistry when you're talking to the actor patient or the actor nurse or your actor dental colleague. You should be very confident while you're trying to speak to the actor, and you shouldn't fumble at any point of time. You should be very sympathetic and considerate, and you should be able to convince him when you leave the room. At no point of time it should appear like a lecture. It should be kind of a conversation where you're talking to a patient in a very similar way when a real patient comes to you. So the key is to keep practicing the actor OSCEs in front of the mirror or with your study partner or with us at planore, and you would understand how it's done. So the blue circle over here gives you a few examples of the actor OSCE. However, there are many more of them. So you need a paper and a pencil while you're performing an actor OSCE, which would help you to demonstrate or draw things when you're explaining it. You can practice it with the help of a study partner, family member, front of the mirror, or with us at planore. Books are usually not required, or you can refer to the Part 1 books in case you feel that you require some guidance for the clinical management. A lot of notes are available in social media, but make sure that they are in accordance with the latest guidelines. We too would be providing notes at planore with proper guidelines. Again, make sure that you don't see the clock when you're practicing at home, but just that there are 2 reminder bells, and make sure that you can simulate the same thing at home. So we would be covering all the possible actor OSCEs through the online videos. Let us give us an example of an actor OSCE so you have a better idea of how it actually happens. For example, the actor OSCE says it's a consent for the extraction of the 3rd molar. So in the first minute outside, you would be given a case scenario and you need to read very carefully. So it may say Mrs. Kelly has pain in the lower 3rd molar. It's her 3rd episode. You have already taken the history and made investigations. Tell her your diagnosis, treatment plan with advantages and disadvantages, and offer all the sedation options. Take consent, and you're given an X-ray. It can be asked in a different scenario. For example, Mrs. Kelly has pain in the lower 3rd molar. It's her 3rd episode. You have made investigations. Take a history and tell her your diagnosis and treatment plan with advantages and disadvantages. Take consent, and the X-ray is shown. So if you pay attention, there is a lot of difference between the 2 scenarios. In the first scenario, you need to tell the diagnosis, the treatment plan with the advantages and disadvantages, and sedation options. At no point of time you need to take any history. However, in the second one, you need to take a small history, the diagnosis and the treatment plan but you do not need to offer any sedation options. And you need to take a consent in both as well. So you need to be very careful as to what you need to do and what you are not supposed to do. They would also tell you what things you're provided with inside so that you have an idea as to how to go ahead with it. So in this 1 minute, you need to think about how you will talk to the patient and what would be the order of you to ask questions. So once the 1 minute alarm rings, you enter and you're given and provided with the actor patient, the x-ray of the patient and a pencil and paper to help you draw. You may or may not be given a pencil and a paper. In that case, you just need to point out in the x-ray and explain to the patient. So as soon as you enter, quickly find out what all has been provided to you. Greet the patient and then start talking to the patient in a systematic order. This systematic order is the guidelines which has been given and you're marked according to the same guidelines. So you would start by taking a history if you are asked to do so. Then tell the diagnosis depending upon your history and investigations. The treatment plan, advantages and disadvantages, and all the options of sedation. And then take a consent from the patient. So when you're talking to the patient, make sure that it's not a lecture and you're actually talking properly to the patient. Be sympathetic and make sure that you cover all the points because you're going to be marked on that. You keep pointing to the x-ray and showing the problem or drawing it on a paper and showing what the problem is and so on. And try practicing it and doing it within 5 minutes. So when you would study, you need to study it as a topic, and every OSCE needs to follow a systematic order of what you would say. That would be in accordance to the latest RCS guidelines. And to follow the order, it is very important that you keep practicing and you also know the different scenarios in which it can be asked, because it wouldn't be the similar scenario which you practice at home. It may be a little different at the exam. So you need to be very confident and at all points of time try and convince the patient, be confident and always give him options rather than telling him what to do or what not to do. So whenever we at planore would do an OSCE or an actor OSCE together, we would provide you with notes for the RCS guidelines as well as in a written format how you need to speak. We would try and give you different scenarios of the same actor OSCE, and we would give you tips in practicing in less amount of time so that you can utilize the rest of the time in asking the patient if he has any questions. Because usually in an exam scenario, the patient has 1 or 2 questions and it's always better to answer them as well before leaving the room. So this was the end of part 2, and you can catch up for the skill OSCEs in part 3. If you like us, come join us at planore or contact us through any of the following. Thank you for listening. Bye-bye.